Hello, this is Dr. Gabe from First Look MRI, and this is a 54-year-old male with complaints of wrist pain. He's had no injury and the pain's been present for over a year. And by history, they think he has tenosynovitis, but on this view we see that there's something else going on. He has an MRI after an arthrogram. So the arthrogram is a procedure where we put fluid into the joint, some contrast, and the contrast will show up as bright or white on this. So this is contrast all here between the bones of the wrist, contrast here, outlining the structures. This is another view where the contrast is also bright here, and we see the bones dark. This is the radius, ulna. This is one where there's no fat suppression, so the bone is bright. This is the radius and ulna. These are all the carpal bones, and these are the metacarpal bones here, more distally. So in this view, we see two abnormal findings in this patient. They have, number one, a tear of a little structure here. It looks like a little meniscus that goes across. It acts as a shock absorber between the distal ulna and the carpal bones, especially between the lunate and the ulna here. And this dark band is part of it. And over here, this little triangle is another part of it. And we see that the patient has a tear of their triangular fibrocartilage. That little band is called the TFCC, or triangular fibrocartilage. Say it again, triangular fibrocartilage. And right, this is called the central disc right here in the middle. And the TFCC also has a dorsal band and a palmar band. This is the dorsal band right here. Looks like it's partially torn. This is the central disc area that's torn, has a hole in it, and the fluid is going right through that tear down here into this location, which is abnormal. The fluid is injected over here and is tracking across here, which is normal, but not normal to go down here. And when we see fluid down here, we know that there's a tear of the TFCC, and here we see a nice big tear. This may be related to abnormal proximity between the ulna and the lunate bone. There's a very narrow space here, and normally the ulna is shorter than the radius. Down here a little bit, so there's room for that triangular fibrocartilage to go across here. But in this patient, the ulna is a little bit too long. We call it a positive variance, just slightly too long. And when it is too long, the space here is narrowed. There can be abnormal mechanics of stress on that TFCC, and in this patient, it may have led to this tear. So they have a torn TFCC. The contrast is going through the tear down into this potential space here called the distal radial ulnar joint. Also, we see there's abnormal contrast here. So the contrast again should be just here between the radius and these carpal bones, but instead it's gone through these bones. This is a widened interspace between the scaphoid and lunate. Here we see the scaphoid lunate. And there's a little ligament here called the scapholunate ligament that is torn, and that's allowing the contrast to go out into the mid-carpal joint here between these. So two findings, and this ligament tear is going to be a very serious injury. These bones will drift apart. This capitate bone here will go downward, drive downward, and cause this to splay. This will become wider and wider, causing pain and instability, and eventually it can cause arthritic changes and bony remodeling here, the scaphoid bone. So significant findings in this patient that will require surgery: a torn scapholunate ligament and a torn triangular fibrocartilage here. And both of these we can see better because the contrast is in the joint that go through both of these tears into these abnormal spaces. And that's it. Thank you very much.